Oh, okay.
Hello, and thank you for tuning in to McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. And tonight, just like every night, we're going to get to some latest news and then general questions. So first, I want to say hi to you, Mom and Dad, Dr. McDougall and Mary. How are you?
Hello.
Great to see
We're just
you.
doing fine, Heather. But we really look forward to our 5 o'clock sessions every Sunday night at Pacific time. We'll get a chance to meet with you folks. And so I hope you're spreading the good news, because there are a lot of sick people out there, I'll tell you. And, we have a good answer for them, a real simple answer. And well, I don't know, should I just get into what has been bothering me this week, Heather? I get involved
Go ahead.
in topics, and it's because, I keep learning things all the time. And mostly, I have to tell you, it's basically refinement of things that I fortunately was able to discover about 40 years ago. So I want to talk to you about a little bit about that tonight, and then we'll get on with questions. Heart disease. Heart disease affects half the population at least. And let's talk a little bit about heart disease. And I gave you some references there. I lost you. I got you there, Heather?
Yeah, she's still there. Yeah.
I'm here.
Yeah, well, that's beautiful. I don't know what's going on here. Anyway.
Well, you're screen sharing, but I can't. So there we go. Perfect.
Oh, okay, good. Well, I don't know. Sometimes, Heather, I think I need to go back to college. Can you see it okay now?
Yeah, it's great.
All right. So what I wanted to talk to you about is I was reading in the cardiac journals, and I was reading about one of the dilemmas that the cardiac business has, and that is finding the culprit lesion. They're trying to find something to operate on, to fix, so that they can help people. I mean, doctors want to help people. What I want to talk to you about in the next couple of minutes is that by eating the Western diet, you cause injury to the arteries. And the response to injury is inflammation. Like you smoke cigarettes, your lungs get inflamed. You get a sunburn and your skin gets inflamed. Red, heat, pain, warmth, signs of inflammation. And if something involves a foreign object, then the body takes and infiltrates the foreign object, the foreign body, like, for example, cholesterol and fat, get into the artery walls, and it causes inflammation and injury and healing and so on, and posterior formation and scars, and just a whole bunch of sick tissue the arteries are. Let's take a look at this. Let's see if we can get this going here. Oh, here we go. This is what doctors see on angiograms. If you have any chest pain, this is the gold standard, so to speak, because this is the conveyor belt to the operating room. You get on a treadmill and it takes you right to the operating room, or this happens to be the operating theater that takes you to a surgical procedure such as bypass or angioplasty. But what happens is you get inflammation. You see here the arrows are pointing towards the end stage of inflammation, which is scar tissue. All right. With healing, what happens is you get inflammation. Like, for example, if you get injury to your tendons or your bursa, they become inflamed. If the doctor were going to take an x-ray of that tendon or bursa, they see calcification. Okay, if you had tuberculosis of the lungs, the classic sign for TB of the lungs is miliary tuberculosis. You get thousands of calcifications. If you happen to have injury to your breasts from the rich Western diet, your milk ductals, they develop calcification in the milk ductals. So you get calcification as the end stage inflammation. And what we're looking at here is calcification of the coronary artery on the right-hand side of the slide. The bright white deposits that you see there are calcium deposits. They're laid within scar tissue.
Would that be like getting a callus on your finger?
Well, it'd be more like somebody cutting you.
Yeah.
And the wound healing, and you have a scar left.
But it's also not, it's not smooth skin anymore.
No, but if you had something that was constantly irritating it, you would develop a thick scar.
Well, that's what I was thinking about, a callus. If you walk on your feet wrong.
That's more of a superficial thing. This is deep injury.
Okay.
So anyway, we have these calcifications in here. And that's what doctors see on the angiogram. You see these swellings, these fibrous areas. Well, the problem is that doctors don't have a way to treat the killing part of the disease, which I'm going to talk to you about now. All we do is treat the old scars, the calcified scars, the non-lethal scars. That's what we treat, because that's what we can see on angiogram. That's all we can see. And we only have instrumentation to go in and squash or cut or laser treatment of the scars. We don't have any inflammation any treatments to treat the killing part of the disease. The killing part of the disease is this little pustule you see over on the right-hand side of your slide. You see, you get inflammation of the arteries, which is the stages you see here. You get buildup of, like you say, Mary, you see how thick it gets?
Yeah.
Okay, and then you get calcium laid down as the end stage. But what you have during all of this inflammation and sickness in your artery walls is you get these pustules.
So that yellow stuff.
Yeah, that yellow stuff,
Okay.
like a pimple on a teenager's face.
Okay.
And it bursts. These pimples are inside your arteries, they burst. Now, these pimples are filled up with necrotic material. They're not calcified. You can't see them on angiogram. All right, so here's a demonstration of what happens here. You have injury of the inside line of the arteries. The result is a festering sore, just like you were going to burn your hand or throw acid on your hand or get an infection. You get a sore as the healing process, and that sore develops with an inner core of semi-liquid necrotic material, which bursts, and that causes a heart attack. Let me show you. You see, this is something I put in a book that I published in 1996. You see the injury there, the plaque. You see the fissure developing in the plaque, and the inner contents of semi-liquid necrotic material is what comes spurting out of the plaque and causes the blood to clot. Now, this is important for you to understand because we don't have any way to treat this. We can't even predict which plaques are going to rupture. We're darn sure just by, taking care of probably several million people that the hard fibrous plaques don't kill. All right. So here's a kind of a video illustration of what goes on. You have injury to the artery walls, all right? And you have this pustular material, which is in yellow, developing behind it. And then you develop a crack in the inside line of the artery walls. Okay, what we're going to focus on is this.
Oh, there's the crack.
There, you see the crack, and you see the pustule developing there. Okay, that's how you get a heart attack. What lies distal dies. All right. So what we're going to identify is we don't identify these culprit lesions, these not hard fibrous plaques which are being treated. But we want to be able to identify the volatile hot plaques that rupture. And that's what doctors are trying to do now. And that's what I gave you 3 up-to-date references on. This has been a pursuit the doctors have had since they started studying heart surgery back in the early 80s, is to find out which lesions are going to pop. Here's a final illustration I gave you from the University of Pennsylvania. Let's see if we can get this going here. You have listened carefully.
In healthy coronary arteries, the blood flows without obstruction. In diseased coronary arteries, a fatty substance called plaque forms in the artery walls, and as the disease advances, may bulge out into the path of the onrushing blood, blocking the oxygen and nutrients the heart desperately needs, and from time to time, causing symptoms like chest pains and shortness of breath. But heart attacks result more often from plaque that does not protrude into the artery itself, but remains hidden in the artery wall.
One of the scariest things about coronary artery disease is that it can remain silent for so long. You can have plaque buildup in the coronary that isn't causing you any problem, doesn't cause you any symptoms, doesn't even cause a positive stress test, but suddenly ruptures. It ruptures, it causes a blood clot to form, the rest of the coronary artery, the rest of the pipe suddenly gets blocked, and a heart attack occurs. And that's really the most common cause of heart attack. This is
okay. So do you understand what's going on here? You've got diseased artery walls in various stages of healing. In the early stages, you've got these volatile pustule plaques. In the late stage of healing, you've got scar tissue and calcification. doctors only know how to identify and treat the hard fibrous scars. What the 3 scientific papers I gave you were dedicated towards efforts to identify which plaques are likely to rupture. We know the hard fibrous plaques, which we're treating with heart surgery, don't rupture. We don't have any instrumentation to treat the volatile plaques, but we're at least trying to identify them. And that's what those research papers I gave you. This was discovered in the 1980s. And you ask me whether doctors are still the same understanding and pursuing the same issues. So which plaques are most likely to rupture? The ones that are most filled with junk, with necrotic material, with fat.
And you couldn't tell that.
Well, actually, on the new computerized CAT scans that they do, they can get some characteristics of the plaque, and the ones that are filling up with a whole bunch of gunk, you'd expect.
Oh, really?
Yeah, you could.
Okay.
They're starting, and that's what one of the papers is about. They're starting to be, and also, the early calcification. There's certain characteristics that the plaques look like. All right, so I wanted to tell you that, and then we go and we treat with an angioplasty. We treat these hard fibrous scars.
But you must, I mean, how do you decide which person to do a CAT scan on to see whether there's a volatile plaque?
Let's just assume half the people die from heart disease and stroke. So it's pretty common.
Yeah.
So when anybody comes to a doctor, emergency room with chest pain, classic
They
symptoms
should do it?
well, they do often.
No, okay.
They shouldn't. I mean, the first step when somebody has blocked arteries is not heart surgery. It's good medical therapy. Like the doctors include good medical therapy to think about in terms of aspirin, statins, and maybe cutting your skin off your chicken and low-fat milk. I mean, that's really the armamentarium of most physicians. Anyway, what they do, Mary, and answer your question, is most people have these hard fibrous plaques, but they also have the volatile plaques going on at the same time.
I know, but what I'm saying is, so if you go into the emergency room and have a CAT scan, you can see which ones are volatile?
You can't tell, but that's what they're working on. That's what those
Okay.
papers I gave you are trying to do, because
they're trying.
I mean, doctors really want to help people. But all that's available to them now is the hard fibrous plaques, so they can see them, they can find them, and they treat them, and you know why they treat them. All right. So anyway, we have multiple studies done. I'm going to go over them real quickly with you. You can run by the video afterwards and look up the studies. And you'll see that I haven't left any out. These are all the studies done on the results of angioplasty, heart surgery. We're talking about sticking a catheter up your leg into your heart, blowing up these hard fibrous plaques. We've got, and I'll go through quickly, the old study, no survival benefit, no reduction in death, no reduction in heart failure. We have the Courage study, same thing, no reduction in death, heart attacks, etc. We have 12 randomized trials. Here's 14 randomized trials, 15,000 people, no benefit, no survival benefit. How are you going to get survival benefit when you treat the hard fibrous calcified non-lethal plaques?
So all those stents they put in, they're worthless.
Well, there's no survival benefit. But people, when they go to the doctor with chest pain, doctor, you have a treatment that'll make me live longer or better at least. Well, half the time this procedure can relieve chest pain.
Okay.
Okay, but it doesn't cause survival, and that's what I want to show you.
Survival is what
Survival is what I want.
what everybody's looking for.
That's why I paid the doctor $30,000 to $300,000. But
Because
look at this.
survive. Okay.
All right, here's totally occluded arteries that they totally opened up. No survival benefit. In really sick people like diabetics, no survival benefit in doing these procedures. People with severe heart failure, no survival benefit. See, when you've got a treatment that's a very weak benefit, you've got to apply it to very sick people to see any benefits. So they looked at really, 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 really sick people, no survival benefits. Anyway, there's another kind of procedure that we do that treats old scars too. It's called open heart surgery, where they open your chest, they put you on a heart-lung machine, which causes brain damage, essentially 100% of the time. We don't have time to go into the cause of brain damage from open heart surgery, but let's look at the results on survival benefits there. Here's the 3 studies, the CAS, the Veterans, and the European study. They were all published in the 1980s. No survival benefit from treating hard fibrous plaques. All right, here are the studies. You can look them up. There's the 3 studies in case you want to.
10 years. 11 years, 12 years?
In the 80s and 90s.
Wow. Okay.
All right, so they've done one more study though. I want to show you that, Mary.
Okay.
This is just published. It was published in 2016. In people with very severe disease. Remember, weak therapy, if you apply to really sick people, you can see some benefit. But no survival benefit at 5 years, a tiny bit of survival benefit at 10 years. Excuse me, I think you're not being given the truth. Anyway, why are they doing this? 80% of hospitals, whether they keep the hospital doors open or not, depends upon the heart surgery business.
Oh, well, we hear about that here. They close hospitals because they don't have enough profit.
Well, it's not because people are getting healthier.
Well, I know that.
Maybe I don't know. Anyway, there's also an article I gave you on the effect of statins on plaque involvement. You can read about that. You can see that statins make very little difference. And that's why when you look at the benefits or lack of benefits of giving statins in heart disease, the lack of benefits way outweigh the benefits. And again, another issue which we've been misled for the last 20 years. The doctors used to say we should put statins in the drinking water.
And look at how new those
22, yeah.
Yeah. Those reports.
Well, Heather objects that I haven't brought her the most up-to-date scientific research that confirms things that I discovered 50 years ago. The truth's the truth. That doesn't change. Read these 3 articles on plaque disease, and you'll see that doctors are still confused about what to do. They see these hard fibrous plaques. It's irresistible, especially since there's a $30,000 price tag attached to it. And they treat it with crude instrumentation, which is open heart surgery and angioplasty. Whereas when you stop the injuring part of the disease, which is the food, then the arteries heal. Okay, do the scars go away? Well, there's some evidence the scars will go away, but we know clearly with work from cardiologist and Dean Orange, David Blankenhorn from UCLA, we know clearly this disease, it heals. But you got to go with the food. You're not going to heal with aspirin, statins, or any kind of surgery that deals with old fibrous scars. And if you figure out how to identify the volatile plaques and a way of treating the volatile plaques other than feeding people potatoes and rice and broccoli, you could be a billionaire. All right, Heather, I'm ready for your part.
Great, thank you. I'm going to stop your screen sharing.
How about your papers? Did you have any papers?
I had a few other things. I read the paper all the time.
You printed out some good ones this week. That's old. You did that one already.
Anyway, I don't know which ones I picked up, but I wanted to focus on the coronary disease.
All right.
So, these people are going to be dealing with this. Their grandpa or their brother. How many people deal with heart disease? Half the population.
Yeah.
And we're not talking about just heart attacks. We're talking about strokes, loss of vision, which is macular degeneration. We're talking about hearing loss, which we talked about a couple of weeks ago. When you plug the arteries with these closures, these plaques. And that's why a lot of these things happen suddenly. You're perfectly well, everything's just going wonderful, and bam, it hits. An elephant sat on my chest. I was fine just 2 minutes ago. It was because a plaque ruptured. I had a fellow medical student who went deaf in one ear during our medical training because he broke a plaque in his ear. Anyway, these things rupture all over the body. You've got tens of thousands of miles of blood vessels that are diseased with pustules that are ready to pop. Stop aggravating them with the food. All right, Heather, your turn.
Thank you. Okay, lots of questions coming in. Let's start out. Let's see. Alan has a question and wants to know if you have any comments on the Framingham Risk Score.
Yeah. Well, Framingham, that's from Framingham, Massachusetts. And it's a population in a community in Framingham, Massachusetts, where they took the people there and they studied them to see what happened during the course of life. They didn't change anybody's diet. Okay. I mean, they may have given them some casual dietary advice, but it was not a dietary program. And they made observations as to who had a heart attack and what characteristics these people might have had. Like as they got older, they had more heart attacks. When they had higher cholesterol, they had more attacks. Higher blood pressure, more heart attacks. So those are what are known as risk factors. And these would be the Framingham risk factors that were developed back in the 60s, 70s, and 80s. And you know that I use risk factors. You know, I tell you what, I don't ask you to treat risk factors. Remember, they're risk factors, not diseases. Nobody's died of high cholesterol. And I've been at this 55 years. I've never seen anybody die of high cholesterol. They die of rotten arteries from the bad food. Likewise, with high blood pressure, people don't really have strokes from high blood pressure. It's the rotten arteries that fail. You know, healthy blood vessels can stand pressures of like 400 over 250 millimeters of mercury or 300 millimeters of mercury. Healthy vessels don't break. Sick vessels break. So by treating the risk factors, the signs, the symptoms of disease, without treating the underlying disease, you don't get a survival benefit. Anyway, those are the Framingham risk factors. And by the way, out of Framingham, and they say that I was the one that made this observation, but you could prove me wrong. When I was studying the Framingham data, what I noticed was that no one had a heart attack with a cholesterol less than 150 milligrams per deciliter. You divide by 38 to get international units, by the way. So nobody with a cholesterol less than 150 had a heart attack in the Framingham study. So I started talking about, in places I went, that, you know, when people have cholesterol 150, they're pretty much immune from heart disease. And that's been, I think, taken to a greater value than I really meant it to be, because people have heart attacks that have cholesterol less than 150.
Yeah, we've heard of it.
Yeah.
Not many, but a
Well,
few.
sometimes what happens is somebody has a heart attack and they're sick and they don't eat. They go to the hospital and then they get the cholesterol checked. So that is part of the reason that you don't always see a high cholesterol with heart attacks, because they haven't eaten 3 or 4 days, so their cholesterol comes down. But, you know, cholesterol is a sign of disease. It's not the disease. You know, you can't treat signs and expect people to get better. Fever is a sign of pneumonia. So if you give a patient aspirin and you lower their body temperature, but you don't treat the infection in the lung, guess what happens? They die with a normal body temperature. And it's the same thing with statins and other cholesterol-lowering drugs. If you lower the sign, like the fever, you lower the sign with drugs like aspirin, if you don't deal with the underlying disease, you die. That should make a lot of sense to you. Anyway, these are signs. Obesity is a sign. Chest pain is a symptom. You know the difference between symptoms and signs. You know the difference, Heather?
Well, no.
Okay, well, I'll tell you, it was a trick
I
question.
know you'll explain it better than I will
It was a
anyway.
trick question. I just want the signs are things you can see that you observe. Symptoms are things patients tell you about. You know, so people have signs and symptoms. So cholesterol is a sign. Chest pain is a symptom. Oh, learn
Thank
something
you. I
new
love
on
that.
Sunday night,
I
right?
won't forget.
All right. Well, anyway,
Know that one either.
it's amazing what you learn in medical school. So, all right. Well, anyway, next question, Heather.
Okay, great. This is from Jody. She wrote in and she would love it if you could talk about lipedema.
Like lymphedema,
No,
LYPH.
lipedema, this connective
can't-
tissue disorder causing large legs with overgrowth of adipose tissue.
Okay, this is lymphedema, LYPH.
Well, no, she wrote LIPED.
I know, but it's not right. Swelling the legs, swelling the arms and the legs from having the lymph system, LYNPH. The lymph system plugged up, you get lymphedema. Lipedema is when you have lipids in the blood. Lipids are fats. So that's lipedema.
And they wouldn't cause swelling of the legs.
No, that's lymphedema. She thinks filariasis, which is an infection with an organism, maybe a parasite. A little filariasis, you can correct me on that one. But there's a little worm or a little parasite that is in Africa, which infects the person and infects their lymph system. And you have the Elephant Man. Remember the Elephant Man?
Yeah.
It was a big movie.
Yeah.
He had I forget what they call it, there's a name for it besides Elephant Man, but he had
You want me to look it up?
filariasis. You can look it up. Okay. Anyway, so you get lymphedema that way. The most common reason I see lymphedema is in the arm. The arm on the affected side where some meddling doctor got in and took the lymph nodes, which he or she shouldn't have done, because there's no survival benefit from taking the lymph nodes. And I can argue that the lymph nodes are there to defend you, to prevent you from dying of breast cancer. And if you damage them or take them out, you reduce your chances of living. But anyways, they take the lymph nodes out, then you don't get any drainage, you get swelling of the arm. And how do you treat it? Isn't that right, Mary?
It's Proteus syndrome.
Is that what they call it? I don't think.
Yeah.
That's new.
Because
That's the
they-
Elephant Man.
Yeah,
Neurofibromatosis, that's what it's called.
but that's what they said. That's what it was. They thought he had that, but it turned out that he really had that.
Oh, well. Anyway, you get the point.
Yeah.
So, the point being that I don't think there's any effective way of treating this lymphedema. You can raise your arm. Some women have come back to me and said once they changed their diet, their whole body's less swollen and they got relief. But I wouldn't promise you that. I would certainly give it a try to see if it makes a difference. Compression stockings might help. Although it's just terrible damage done to women unnecessarily. In fact, it's harmful to take the lymph nodes out. Totally unnecessary as far as determining treatment. Your doctors, your oncologists will give you the excuse that they needed the lymph nodes to determine the hormone status of a woman. No, you didn't. No, you didn't. You could have figured it out from the tumor you took in the breast. Don't you tell me that.
Now, can we talk
Yeah,
about the other one,
yeah.
lipedema?
Oh, lipedema is fat in the blood. It's triglycerides. That's just, you get lipemic blood. If I were to take some blood from your arm, Heather, or Mary's arm, if I take blood out and I would set the tube of blood on a counter, the red blood cells being heavier than the fat would settle to the bottom, okay? And so you'd have a layer of red, and then you have a layer of yellow on top. That's the fat, that's the lipids. There are people who have such high lipid levels in their blood called triglycerides. Okay, they're fat, and that's fat in the blood. That when you draw the blood out of their arm through the tube, before you take the needle out of their arm, the blood has started to separate into fat and red blood cells right in the tube. That's how full of fat they are. This fat, you've seen the videos I've shown you about blood sludging. Okay, it causes the cells to stick together. It drops the oxygen content in the blood by somewhere between 5 and 20%. It causes chest pain. And so one of the fundamental treatments we talked about, we can talk about it again sometime, is a low-fat diet stops chest pain. Chest pain is the indication for heart surgery because, as I told you in the beginning of this presentation, heart surgery doesn't save lives. So why else can you do it? What other excuse do you give the patient? It relieves chest pain. Well, ladies and gentlemen, just stop eating the garbage and the chest pain will go away. It's a time-honored treatment. Stop the lipemia. Where do you get blood fat from? From the fat on your plate. And also eat a lot of other junk, but yes. All right. Okay.
Thank you. Okay, next question. This is from Candy. She has entered menopause and has been whole food plant-based for 20 years, but has suddenly gained 20 pounds. Her cholesterol's gone up 50 points. So she's wondering if hormone replacement therapy would help.
Probably not. This is one of these people that gains. I'm not going to make a joke about it, but just going through menopause shouldn't cause you to. It should cause you poor health. This is a normal, natural time in a woman's life. It's not a sickness. You just stop making eggs, so your ovaries don't make eggs anymore, and from the time then you stop your period, then you can't have babies. But after, say, 48 years old, you're not supposed to be having babies. Who's going to raise the kids? It's okay for men. Men, can live longer, die soon. Doesn't matter. But women, you got to have another 20 years to act like mothers and to make sure these kids grow up. That's why you don't have babies when you're 82 years old. you'd have no time to raise that. So menopause, first of all, is not a sickness. And starting on hormone replacement therapy would be indicated if you had menopausal symptoms, if you wanted to, well, I think it's a little bit anti-aging. I think taking estrogens is pretty conclusive that it causes women to age, at least as far as outside signs of beauty go, skin, etc. Estrogen will help you in that way, slowing the obvious aging trouble. Increases your risk of uterine cancer dramatically. Taking hormones increases your risk of breast cancer by about twice. Doubles your risk of gallbladder disease, actually increases by about 2.5 times. So you want to make sure
we're eating well.
Well, all that's, nobody's ever studied that. That's the problem, Mary, is they've only studied sick people. My guess is they wouldn't have any trouble.
Yeah, I mean, if you were eating a healthy diet and then you took hormone replacement therapy, all those other things you don't have to worry about anyway.
Well, you don't get gallbladder disease when you eat a healthy diet.
Yeah.
You don't get uterine cancer when you eat a healthy diet. You see, these diseases, heart disease, uterine cancer, and breast cancer, are unknown to occur in populations that eat a diet based on starch, like the Japanese, the Chinese, the people from Thailand before World War II. They're rice-based diets. They didn't have any of these problems. They do now. They do now. Thanks to cable news network, thanks to transportation, thanks to fossil fuels, we can make everybody sick with animal foods and oils. That's where you get these problems. Animal foods and oils, you can solve them, prevent illness, and cure a lot of the problems, not all of them, but a lot of the problems by switching back to a starch-based diet. You know, like grandma used to eat. You go over to grandma's house and what's for dinner, grandma? Well, we're going to have potatoes, or we're going to have pasta, or we're going to have mushu vegetables and rice. And, you know, now you go you go home and you go, what's for dinner? Chicken. What's for dinner? Beef. You know, it's different. It used to be, what's for dinner? Pasta. What's for dinner? Rice. What's for dinner? It used to be that way. It wasn't only but a couple of generations ago. This has all happened within my lifetime.
Yeah, in the 1900s, basically.
My great-grandfather died at 87 years old. He lived in his early years. He was a jockey. He worked on the East Coast, riding horses. And, you know, he was a jockey, little guy. He lived on beans and potatoes the first 50 years of his life because he had no money. And then he got money and he lived on eggs and meatballs and onions the rest of his life. And by the time he died at 87, he had such severe atherosclerosis of his leg arteries, he couldn't walk up the stairs. That's how close his leg artery.
He couldn't even walk across the room.
He died of kidney failure. Finally, his arteries to his kidney, they couldn't walk. But so, you know, it's all happened in the last 50 years. Your grandma and grandpa, unless they were really, really rich, didn't have these problems. My grandpa wasn't really, really rich. Beans and potatoes, that was his diet.
Okay, thank you.
Yeah.
Next question. Let's see. B. Daly wrote in and he said, recently I came across berberine called the poor man's Ozempic. Is it safe or is it reptile venom like Ozempic?
No. But the things I need to learn more about berberine.
Oh,
I heard, well, I got to do a whole bunch of study though, Mary.
Okay.
I mean, this is just a really powerful
Yeah.
herb. It lowers cholesterol, but has not been shown to reduce the risk of dying of heart disease.
I haven't heard it used as a weight loss drug though.
I don't know. You hear the train?
No.
Good.
Oh, and it's loud. They have this special steam train that runs along the river. It's kind of like a Santa Claus thing.
Mhm.
And so they have the Santa train that runs back and forth around the river.
So we have to work. But my guess is, and it's only a guess based on no science yet, because they haven't studied it. My guess is this is just a powerful herb that deals with signs and symptoms.
So bitter tasting, yellow colored chemical. It might help strengthen the heartbeat. It might also kill bacteria, help regulate how the body uses sugar.
It's kind of like Ozempic. It does everything.
Yeah.
These new ads about Ozempic does everything. What's appeared in your local press? A couple of interesting things. One is that that business has gone down dramatically because of Ozempic. People aren't buying the food. They're not buying the junk food. They're buying the groceries. They're not going out to eat. And this has a runoff, a spill. They're not as sick. They're not going to the hospital, to the doctor as much. They're not buying as many drugs. Ozempic is a bad thing for the business.
They'll have taken off the market for just that reason, probably.
Maybe, yeah. But Ozempic was one way. Erectile poisoning is one way to do it. But you could also wire people's teeth together. Or what if there was no food? What if there was no food? What would happen?
Everybody would get them.
Heart disease would disappear. What would cardiologists do? There'd be no breast cancer if we had to change our diet drastically because of circumstances. What if people had to eat
Like we do?
No, not like us. We eat like kings and queens. What if people had to eat like they did in my grandpa's day or in your grandma and grandpa's day? What if there wasn't refrigeration?
Just beans.
What
and
if transportation wasn't there? What if the Suez Canal was dried up and the Panama Canal and they couldn't get to all that goody to our door on time? What if that happened? We could see quite a change, couldn't we?
We could.
Yeah, really. You and I would be passe. We have no place. If the diet changes in the world, which I have good reason to believe it's going on, then Mary and I are out of business.
I think we'll be gone by then anyway.
Fortunately, we live on rice, which is cheap. Otherwise, we're going to be in big trouble too. All right, Heather, I'm getting silly. We need to go on.
Okay, next question. What do you feel about someone that loves to snack on oil-free pretzels?
It's white flour, it's salt.
So not the best
No
snack.
cholesterol, low
Not
fat.
terrible, but
It depends on whether you make, 2% of your diet salty, no oil, no cholesterol pretzels, or 82%. That's a lot of empty calories. That's a lot of lack of nutrients, of phytonutrients. And I don't think that'd be a good idea. Probably you get berry, just like they did when they refined the rice.
You mean if they only ate pretzels?
White rice flour. I'd have to see what white rice flour is deficient in. But my guess is B vitamins and maybe tryptophan. The B vitamins would you'd probably develop a B vitamin deficiency if you just try to live on the majority diet as pretzels. But
that's not what they're asking. They're asking what about snack foods?
I can do a little bit of anything and get away with it. The problem I have, just like you folks, is I can't do a little bit. I either do it or don't do it. And Mary's kind of a moderate person. And she would have likely lived in good health, a little heavier, but in good health without me. Not me, though. I needed Mary to kind of calm me down, put things in perspective, and make me a little bit more moderate. Because I was intent before we met on smoking, drinking, and eating myself to death. And I did a pretty damn good job of it. At 18, I had a stroke. I used to be probably 90 pounds heavier than I am now. I had a major abdominal surgery in my mid-20s. I don't think I'd have made it to my late 20s or 30s if we hadn't met, Mary.
Maybe not.
You really gave me, but because I'm not a moderate person, and neither are you. Okay, that's why you're in trouble. Part of it is you may have listened to the wrong people. The other is you're the kind of person that gets a big bang out of life, like me. I'm a grade AA personality. I just go for everything 1,000%. So you got to teach me the right rules, otherwise I'll kill myself. If you teach me that booze is good for me because it will reduce my risk of dying of heart disease, guess what? That's all I'm going to listen to. You tell me if I smoke cigarettes, I'll exercise my lungs. That's all I'm going to hear. We're just terrible. Human beings are terrible. Well, I think we can guard against some of our natural behaviors. if we have the truth, if we have the information. But if we're lied to, we don't stand a chance. You're being lied to. It's the food.
Thank you. Okay, next question. This is from Sunshine. She has non-Hodgkin's lymphoma and is wondering what the best diet is.
Well, the best diet is our diet. Non-Hodgkin's lymphoma is, well, there's no dietary cure. No, anyone knows. True North has recently taken care of somebody, I believe it was a lymphoma. And whether it's non-Hodgkin's or Hodgkin's, I don't know, but they published their study in the British Medical Journal. True North uses our diet without salt and sugar, but they also fast people. It's a water fast. So that's the only positive thing I can tell you about diet. True North got a cure enough so that it got published in one of the major medical journals in the world, British Medical Journal. And that was through water fasting and going on our diet. But I would look into the science and see what the outcomes are as far as present therapies for non-Hodgkin's lymphoma. I don't know what they are these days. I haven't looked at it. But I would be real careful about looking at that science before I accepted therapies. What causes non-Hodgkin's lymphoma? Let me tell you about a guy named Alan Cunningham, published in The Lancet, I believe in 1979. You can look it up. Alan Cunningham, he came out with the idea that lymphomas were due to overstimulation of the immune system by animal protein, particularly beef protein and dairy protein. Alan Cunningham, Lancet, 1979. Okay, so what he did is he told a story about Dennis Burkitt. You've heard me talk about the Burkitt diet, the Burkitt lymphoma. Dennis Burkitt was an Edinburgh, Scotland surgeon who I've talked to you about, who went to Uganda, Africa. In Africa, he discovered something called Burkitt's lymphoma. Pretty cool, huh? He got this lymphoma named after him. Burkitt's lymphoma is due to overstimulation of the immune system, the lymph system, by constant parasite attacks by malaria parasites. Through constant, there's chronic infection of malaria in that part of the world. So through chronic infection and dealing with these parasites all day long, the immune system gets overtaxed and breaks down into Burkitt's lymphoma. The analogy that Alan Cunningham carried on from here was that eating cow protein, particularly focused on dairy and beef protein, that protein acted just like the parasites, overstimulating the immune system, causing it to break down into lymphomas. I think that's pretty cool. Anyway, again, a dietary disease. Get rid of the beef, get rid of the milk. But it could be due to other things. And unfortunately, I don't remember the treatments being all that good. I certainly would eat a good diet, though. But if they're good treatments, take them. How do you know if a treatment's good? Well, you got to read the science. And you got to look at randomized controlled trials. And then you've got to look to see what happens as far as the most important thing you're concerned about, and that's staying alive. I just showed you at the beginning of this presentation. I just showed you all the studies on heart surgery. All of them. Didn't leave any out. They don't save lives. Why? Because they treat old, hard, fibrous, calcified plaques. That's what.
And they don't make them change their diet either.
Mary, they feed in hospitals the very food that brought people to the hospital in the first place. I know. The food service of a hospital deserves a kickback from the pharmacy and the surgery, because here you have a teaching moment. You're laying there. You've just had something horrible happen to you. And you're saying to your doctors and your nurses, please tell me, I don't want to ever have this happen to me again. Please tell me what to do. Well, you got to make sure you get your protein, because you got to heal this big wound we just put in your chest. So you better eat your hamburger. A teaching moment. The doctors should know, and many of them do know, all the things I'm telling you. Yet this is a business. Do you think they would make money passing out potatoes in the hospitals that I've worked at? Or curing people? No, you keep the doors open by doing things that are profitable. 80% of the income of a hospital that deals in heart surgery comes from heart disease. These people aren't stupid. They're running businesses. Unfortunately, you're the commodity.
Thank you. Okay, next question. This is from AA Strumming. Let's see. Their mother has varicose veins. The doctor wants to do radio frequency ablation and use Varithena in the vein. Can fixing her diet help?
No, no. But if it cosmetically they bother her, we used to inject them with a small syringe and a small needle with a sclerosing solution. It could be a high salt solution, for example, would do it. Did you ever have that done? Mm-hmm. You did, yeah. That's in little veins.
Little veins.
Okay,
I didn't have any big ones, but I had spider veins.
Spider veins, right? So you inject these little veins, and this is a similar procedure. It's a sclerosing effort to take and destroy these tiny little blood vessels that are protruding from your skin that you don't like. Have it done. Laser will do it. There are several treatments for cosmetic reasons, but don't have it done for your health. You know, treating those little veins is okay, but we used to treat big veins. And Mary, you've been on these surgeries where they
they just stripped the whole vein out.
And tell them what they Mary's a surgical nurse.
That was terrible.
Do you remember how they did that?
Well, they opened up a little part of the like by the knee, and then another part down by the ankle.
Oh, you remember more than I do.
and they would they would cut the vein and stitch up the end.
Yeah, I remember that part.
That whole piece of vein right out through the ankle.
You want to talk about lymphedema?
That's just,
this is actually a venous problem. They pulled it. It was, you got this big long, it's like all the side of a garden hose. You know, it's like, depending on how tall the woman is, it's usually a woman. You've got like 4, 5, 6 feet of garden hose. They just stripped out of your leg. Where do you think the blood gets to go now?
In little tiny veins.
Because in the little tiny veins. And guess what? You get more superficial varicose veins. And you get a swollen leg and pain and a lot of other things. They don't do that. I don't think they do that anymore. I think they do that.
I don't know. It's been a long time, so probably not. Maybe they have something better.
More profitable.
Maybe.
I don't know. You know, the goal is to maintain as much good health as you can, and to reverse as much disease as you can. Then, unfortunately, because you know we've not been living by the right set of rules, unfortunately, many of us have scars from our old habits. You know, if you knew me, I'm 76 years old now, but at 18 years old, I had a massive stroke. I lost the entire left side of my body. And, you know, through my life, I did okay. I flew airplanes. I sailed ocean go with sailboats. I sailed the windsurfer. I was never very pretty. I would ski down black diamonds, but you didn't look at me look at the skier and say, boy, he looks good. He looks horrible. I hope he survives, get down the hill. It's been a real handicap for me since I was 18. But that scar won't ever go away. All right. So my mother believed that eggs and chicken and beef were important for calcium and protein. And, you know, if she's still alive today, I'd be careful about her seeing this video, but she's not. She lived to be 93.
Yeah, I think so.
Anyway, she felt terrible after I had my stroke at 18. Every time she'd look at me, I know she thought, I did this to my son. Well, Mom, you didn't know any better. And your parents likely did the same thing to you. But now you know. Don't do it to your kids. Don't do it to your grandkids. So you're left with scars. What I was trying to say is because unfortunate inflammation, we're left with scars. And these scars sometimes maintain themselves. We lose hearing, one ear, lose an eye, stroke, heart attack. So anyway, I've done okay. But I guess the reason I've gotten to this point is that now that I'm 76, I'm losing a little bit of my previous reserve. And I don't think I'd get back on that windsurfer. And I don't know they'd let me fly an airplane anymore.
I think they would.
So, I'm getting old, folks. Catch me while you can. So I don't know how we got on that question, Heather.
I don't either. Okay, next question. Do you have any positive? Gary wrote in me an email. He's doing amazingly well, but he has a friend who has Polycythemia Vera.
Yeah, Polycythemia Vera. Again, you're reaching back in my career.
Oh, I never even heard
It's
of
an
that.
autoimmune disease,
Well, of course.
Polycythemia Vera, and it refers to colored pigmented lesions that occur related to the blood vessels, I believe, on the leg mostly. And like most autoimmune diseases, it's caused by what you eat. So I would suspect that it's not going to go away. I'd expect this is one of the remnants of damage that you have from your previous education. But
Well, what if you change your diet and then it might go away? No,
you could try. Yeah, why not? There's no sense in believing that a virus causes polycythemia vera. I mean, we learned that as a possible theory in medical school as a virus. We also learned it was an autoimmune disease, but we never learned that autoimmune diseases had to do with anything, but maybe a virus, maybe bad luck, maybe the wrath of God, maybe bad genes, could be bad genes, or maybe something we haven't discovered. It couldn't be the food. Couldn't possibly be the food. You can eat anything and everything you want. Just eat a well-balanced diet. Yes, you'll be okay.
Laughing, but people are actually told that, which is
of course.
Oh, yeah, that's the way I was raised. And Heather, the real insult to me physically was for my parents to be taught that protein and calcium were the most important nutrients for them to feed me, when there's never been a case of either protein or calcium deficiency ever described in a human being on any natural diet. It doesn't exist. But the industry's powerful. They got money. So anyway, you same thing. You had parents with that kind of education too, and your parents want to do good things for you. My parents went through the Depression. They had to live on turnips and potatoes. My mother did. Yeah, she would have been one of those homeless people, my mother, that we see so often today, except for the fact that her landlord gave her family free rent, so they didn't have to live on the street. But my mother said that she would never let her children suffer like she did. And we didn't. But we suffered because she didn't learn the right message.
Well, they had no idea back then.
No, not much.
Nobody
But
was
you know,
talking.
was she born in 1920, something like that?
Probably, yeah.
Back then we had McKeel Hinhede from the Netherlands that knew there was no such thing as protein deficiency. There are all kinds of researchers back then.
But they never talked about it in like women's magazines or
Well, it's because just like today, if you have the money, you can carry the message. The money carries the message, and if you believe differently, you're not living on planet Earth like I am. So, figure it out, folks. They don't much care.
Okay, next question. This is from Donna. Can mild pulmonary hypertension be helped with diet?
I think so. This is, there's again, Heather, you've known me for so long, like almost 50 years, but you realize that I'm like a broken record. I just naturally go back to the food as a possibility. And like arterial hypertension is due to increased peripheral resistance in the arterial system into which the heart pumps blood. Well, pulmonary hypertension is in the venous system that drains the lungs. You get a resistance to flow. And so because of the higher pressure, well, there's every reason to believe the pressures in the eye and the venous side of the system, we know for sure on the arterial side of the system, are influenced by what we eat. You've got to open up the blood vessels. You do that with good food. You lower the volume in the body, the amount of fluid, by low salt. So low salt, extremely low salt, like Kempner, will decrease the volume so the pressure in the lungs and the heart goes down, and the eyes. I say that with limited data, the eyes and I'll look up the pulmonary hypertension and see what work's been done on diet. But yeah, I listen, until you've changed to a starch-based diet for 4 months, okay, 12 days, oh, maybe even 7. But let's make it fair, okay? Until you've eaten a starch-based diet, cleaned up your bad habits, gone for a walk, get a little sunshine for 4 months, do not declare yourself incurably ill, because you're not. Because you're not living in an environment that supports your health and healing. That environment is based on starch, corn, rice, potatoes, sweet potatoes. We had sweet potatoes for lunch today. We had leftover sweet potatoes for lunch and green beans.
Yes.
Yeah. So it was good lunch.
They were good.
It was good. And
Just as good as the night we had them.
well, you cook very simple and don't spend a lot of time in the kitchen these days. But I'll tell you what comes out of the kitchen, Mary, is really amazing. Jason, we were entertaining a couple of options tonight. One was there's a Vietnamese restaurant close to us that really serves oil-free, clean food, but it's expensive. And the other option was
Fried rice.
fried rice. And guess what your son chose?
Fried rice.
Really? Wow. I would
He
Right.
loves the Vietnamese restaurant, but yeah, he wanted to know after this session today, how much time we spend on it?
About 10 minutes.
10 minutes. A lot easier than having DoorDash come to the place.
Take a lot longer for DoorDash.
Yeah, really.
a lot
They
cheaper.
get the order wrong. You never get the order wrong. Anyway,
Oh, sorry.
you're missing an opportunity if you're not doing what we suggest. And your friends and relatives are really missing an opportunity if you haven't at least asked them to let us open their eyes. Let us give you a chance while we have an opportunity to tell you what the truth is. Let's build an army. Let's build a revolution. Let's change the world to a better place, because you can do it along with our help. I think so. Sure like to try. Nothing more than I'd like to, have people save themselves and the planet. So,
Okay, we've got a few minutes left, so I think I can cram a couple more questions in here. Cultivating Joy wrote in, she's starting out on the maximum weight loss program and wants to know what a serving is of fruit. Is it an apple, a whole banana? Does it really matter?
or a whole watermelon?
Yeah.
I don't know, just a
Well,
typical.
usually say a cup.
Yeah,
So that would be like an apple or one banana
yeah,
or
I think
one orange,
most people know what a serving size
half a
is.
grapefruit. Oh, maybe like this many blueberries.
I don't think that's a tough question to answer. But we've got sweet potatoes today that are probably 2 serving size. We got sweet
Yes,
potatoes
some sweet
that are
potatoes.
that big. And when we looked at them this morning, I said, Mary, we won't be able to eat even one of those between the two of us. Maybe.
No, we can.
Okay, one. But we got these 3 gorgeous, there's more than a serving size. It's 2 serving size sweet potatoes. I'm sorry, I can't give you a more definite answer. Just kind of look at it. A banana is a serving size. A cup of fruit is a serving size. Good enough. Yeah.
Thank you.
It's just like we tell you to eat, I tell you to eat 90% of your diet is starch. Mary says 70 will do. It's not that strict a guidelines. You just need to get the principles right. Animal foods and oils are poisons. They are killing you. Corn oil, safflower oil, canola oil, any fruit oils are killing you. Animals, whether they be their parts of their bodies like their livers and their muscles and their brains and their feet, or secretions from animals such as milk or blood. I would not consider a secretion or a body part. They make sausage out of blood.
Yeah, but you have to kill the animal to get that. You don't have to
Supposed-
kill the animal. to
Okay,
get
okay,
the
I take-
secretion.
I take blood sausages out of that category of secretions. We'll just leave that at milk. Well, they do. They make sausages out of the leftovers at the slaughterhouse. Come on, guys.
You're right.
Get
Yeah,
with-
blood sausage. It's even
Yeah.
cooler.
They
let's
even
see.
call it that, yeah.
Let's see, you got a tube of blood and muscle, or you've got a sweet potato. What are you going to choose? Come on, what are you going to choose?
Sweet potato.
I know there was
every time.
a day when I would have picked the muscle. If they spice, see the way they get away with the blood sausage, Heather, is they make it so heavy in spice.
But you can't taste the rest.
What is the joke? If slaughterhouses had glass walls, no one will eat meat.
Yeah.
Or you know, one thing you don't want to do is you don't want to go to a slaughterhouse to see your meal prepared. This is disgusting. Come on, it's disgusting. You're a better person than that. It's just like tomorrow morning I'm going to give a lecture for Chef AJ's group on low carb diets. And you know, the audience I talk to tomorrow morning at 10 o'clock on Chef AJ's YouTube channel, talking about low carb diets. I'll talk to you about the disadvantage of low carb diets, how you lose less weight when you get the carbs out of the diet as opposed to keeping the carbs in. Kevin Hall's work. Kevin Hall was a guest at one of our advanced study weekends. He ruined Gary Taub's life by teaching this, the Big Fat Lie author, that he was full of, what would he be full
Big fat
of?
lies.
Big fat lies. He's full of stuff because Kevin Hall proved it wrong. We're going to talk about that tomorrow. But one of the questions I asked, I showed a picture of low carbers and what they eat. How do you eat this stuff? I showed a picture of a slaughterhouse.
Oh,
Pretty
no.
nasty. Yeah, pretty nasty. I also
That's very bad.
showed a picture of a burning planet. Well, how do you do this? I mean, you know, even if you're not concerned about yourself and your family.
They don't think about it. You go to the supermarket and everything is all packaged up and it looks really nice on the shelves. And, you know,
What does it look? You know, I want to question that from you, Mary. Who does it look nice? When I used to go to the
well, it
supermarket,
looks nice to people that are shopping for meat products.
they like bloody stuff.
Well, you don't see the blood.
They clean it off,
Yeah.
put it in packages.
We're out of time. You guys are going to go on and on and on about this. Gross. It's not our food. We definitely want to focus on starches, grains, legumes, vegetables, and fruits.
Right.
That's a much better way to end this hour.
Listen,
Remember the fried rice.
we're having a growing census for this 5 o'clock Pacific time, Sunday evening discussion that the three of us get together and have with you. So you're telling your friends and relatives that at least tune in and see what John and Mary have to say. You know, it might be something different. Maybe you will learn something, or maybe you'll at least figure there's something worth trying. So we've like tripled our attendance of this 5 o'clock presentation in the last couple of years. So let's triple it again and triple it again and triple it again. Certainly all the forces are out there. The truth is gotten out because of smartphones and computers that you can't hide. Liars, cheaters, and polluters, we're going to get you. You're not going to be able to hide.
That was a fun hour. Thanks, Mom and Dad, Dr. McDougall and Mary. Thanks, everyone, for tuning in. We'll see you all next Sunday at 5 p.m. Pacific.
Bye-bye.
Okay, bye-bye.